Why did a newborn baby pronounce Allahu Akbar before even crying? What I witnessed in that operating room challenged 15 years of medicine and made me question everything I believed about science. I am Dr. Michael Williams, an obstetrician trained at Harvard, specialist in fetal medicine with 15 years of career at Holston Creek Regional Hospital, Mississippi. During my professional trajectory, I performed more than 3,000 deliveries, including complex cases that defied medical statistics: conjoined twins, extremely premature babies, rare congenital anomalies. I was always a skeptical doctor who believed exclusively in what could be measured, tested, and scientifically proven. My reputation was based on diagnostic precision and technical rigor. Colleagues consulted me about difficult cases because I always found rational explanations for the most unusual phenomena, until that dawn in July 2019 when everything changed. This is not a story of faith or religion. It is the detailed clinical account of a doctor who witnessed something that contradicts all known medical literature, a case that transformed not only my perception about the limits of science, but also an entire community divided by historical prejudices. Before continuing, tell me where you're seeing this story. I always read and get curious. Stay until the end, because what happened with this child goes beyond any scientific explanation, and I have all the medical documentation to prove it. July 2019 represented the worst period of my personal and professional life. 15 years of intensive medicine, thousands of procedures performed, and I had become exactly what I swore never to become: a cold and calculating machine, incapable of seeing beyond the technical aspects of medicine. My wife Sarah left me 3 months earlier, taking our 8-year-old daughter Emily. Her final words still echoed painfully: "Michael, you saved so many lives that you forgot how to live your own. You completely lost the humanity that once made me fall in love with you." She was absolutely right. I had developed such a rigid emotional armor that seeing a baby being born had become just another routine procedure on my surgical agenda. I openly mocked colleagues who spoke of medical miracles or divine interventions. For my scientific mentality, everything had rational and provable explanation. Coincidences were simply predictable statistical manifestations. Religious faith represented only well-documented placebo effect in psychological literature. Inexplicable recoveries always had a scientific basis that other doctors couldn't identify. Holston Creek was a small and conservative town with only 12,000 inhabitants, historically divided between a Protestant Christian majority and a small Muslim community that lived practically socially isolated. I treated patients from both communities with the same professional coldness, avoiding any emotional or religious involvement. It was in this mental state that I found myself when I received the emergency call that would change everything. It was exactly 2:20 a.m. on a rainy July dawn when my pager went off with red code: obstetric emergency, urgent cesarean section needed. Intense rain hit the hospital windows, creating an atmosphere that retrospectively seemed to foreshadow something extraordinary. I quickly headed to the surgical center, where I found the team already preparing the room. The patient was Hyla Foster, 32 years old, practicing Muslim first pregnancy after documented 10 years of infertility. Her medical record showed multiple failed treatments, including in vitro fertilization, before this unexpected natural pregnancy. The surgical indication was clear: breech presentation with partially wrapped umbilical cord, representing significant fetal risk. Routine procedure that I had performed hundreds of times during my career. Nothing in the clinical picture suggested any abnormality or unusual complication. Jamal Foster, the husband, waited anxiously in the corridor, holding a small prayer chaplet, murmuring supplications in Arabic. His expression mixed hope and terror, the same I had seen in thousands of parents during similar situations. The surgical team was complete: 2 experienced nurses, a competent anesthesiologist, a technical assistant, and the scrub nurse. All professionals who had worked with me for years, knowing perfectly my standards of precision and efficiency. At 2:35 a.m., we began the procedure. Epidural anesthesia applied without complications. Technically perfect incision performed. Uterine access without complications. Everything was proceeding within the most absolute expected medical normality. Just another routine surgery in my career, or so I thought at that moment. At 2:47 a.m. I completed the fetal extraction without any complication. A 3.2 kilos boy with all perfect vital parameters, ideal pink coloration, adequate neurological reflexes, APGAR 9-10. Anatomically, an absolutely normal child, according to all known medical criteria. I positioned the newborn to stimulate the first characteristic cry, fundamental neurological reflex that every baby presents in the first 30 seconds of life to expand the lungs and establish independent breathing. It was a technical moment I had witnessed thousands of times, but what came out of that baby's mouth completely froze me. Allahu Akbar. La ilaha illa Allah. It wasn't a cry. It wasn't a reflex scream. They were articulated words, clear, pronounced in perfect Arabic. Complete sentences coming from a newborn who, according to all world medical literature, should not have neurological control over the laryngeal musculature to produce articulated sounds. The silence in the operating room was absolutely devastating. I immediately looked at the 5 people present. All had the same expression of total shock and disbelief. Head nurse Kathy Morrison, with 30 years of experience in obstetrics, whispered with a trembling voice, "Doctor, did you hear?" My scientific training went into action automatically. "Laryngeal spasms," I replied mechanically, resorting to the only rational explanation my mind could formulate. Known phenomenon. Involuntary contractions of the glottis can produce sounds that occasionally resemble articulated vocalizations. But my own voice came out false and insecure. I knew I was deliberately lying to myself and to everyone there, and this was just the beginning of the impossible. During the 2 days of mandatory hospital stay post-cesarean, I observed Hassan Foster with obsessive intensity. My scientific curiosity was in maximum alert, driven by the urgent need to find a rational explanation for what I had witnessed. I requested a complete battery of tests that normally wouldn't be necessary for a healthy newborn, looking for any anatomical or neurological abnormality that could justify impossible vocalizations. I meticulously documented all results. Neurological development, completely normal for gestational age, cranial MRI, perfect brain structures without malformations, laboratory tests, all parameters rigorously within normality, specialized laryngeal evaluation, absolutely perfect vocal anatomy, neonatal audiometry, ideal hearing capacity. But the impossible vocalizations continued occurring regularly. Other nurses from alternate shifts reported identical episodes during routine care. Always the same syllables in classical Arabic, always the same melodious and soft tonal pattern. The occurrences were spontaneous, without apparent external stimuli. I discreetly requested a consultation with Dr. Roberto Silva, speech therapist specialist in neonatal disorders, from the Regional University Hospital, claiming need for preventive evaluation of possible congenital vocal alterations. After examining Hassan thoroughly for 2 hours, using specialized equipment for vocal analysis, Dr. Silva approached me visibly disturbed. "Michael, anatomically this baby is absolutely normal. There is no structural alteration that justifies articulated vocalizations. What you're suggesting is neurologically impossible, according to all known medical literature." I knew he was correct, and this scientific certainty bothered me deeply. Dr. Roberto Silva was considered one of the greatest authorities in neonatal speech therapy in the American Southeast region. His perplexity before Hassan's case confirmed my own scientific disbelief. "Mike," he continued, "newborns simply don't possess necessary cortical control over laryngeal musculature to articulate complex phonemes, much less complete sentences in any language." He explained in detail the neurological impossibility. The development of articulated vocal control requires maturation of multiple brain areas, motor cortex, Broca and Wernicke areas, specific neural connections, that only complete between 12 and 18 months of age. It's simply impossible for a newborn. During the following weeks, I consulted international medical literature, contacted pediatric neurology specialists from renowned universities, researched scientific journals looking for any remotely similar case. The result was devastatingly clear. 0 documented precedents in world medicine. The decisive moment occurred when Hassan completed 6 months of age. During a routine pediatric consultation at 2:30 p.m. on a January afternoon, the Adhan, Islamic call to prayer, echoed melodiously from the small mosque located approximately 300 meters from the hospital. It was a familiar sound in the region, part of the daily soundscape. Hassan, who was playing quietly in his mother's lap with small colorful toys, suddenly interrupted all movements. He turned his head with exact precision in the direction of the distant sound, and began to vocalize the same words in classical Arabic, as if he were consciously responding to the religious call. The synchrony was perfect, impossible to be coincidence. Hassan not only heard the adhan, but reacted specifically to it with appropriate religious vocalizations. No 6-month-old child possesses cognitive capacity to associate external sounds with specific vocal responses. At that moment, I was forced to admit the unthinkable. There was no known scientific explanation for Hassan Foster. The definitive turning point in my scientific perception came when I decided to investigate deeply the Foster family's background. Jamal Foster, 34 years old, worked in civil construction in neighboring cities, performing masonry and residential renovation services. Simple man, educated, practicing Muslim, who regularly attended the small local mosque. Hila Foster, 32 years old, freelance seamstress who offered tailoring services to the regional community. The couple had documented medical history of primary infertility for 10 consecutive years. They had tried multiple treatments, hormonal therapies, in vitro fertilization, artificial insemination. All procedures failed. Hassan's pregnancy was completely natural and unexpected. Modest financial situation, without private health insurance, exclusively dependent on the public health system. They lived in a simple house in the predominantly Muslim neighborhood of the city. They had no financial resources or apparent motivation to elaborate any type of medical fraud. I discreetly interviewed each person present in the operating room during the original birth. All unanimously confirmed the same impossible version of events. 2 nurses, the anesthesiologist, the technical assistant, experienced professionals, skeptical, accustomed to unusual medical situations. Even Curtis Benson, a local businessman known for his prejudiced opinions against the Muslim community, admitted having witnessed something scientifically inexplicable when he visited the hospital, driven by skeptical curiosity. "Doctor," Curtis confessed to me with evident discomfort, "I went to the hospital specifically to unmask this supposed farce. I thought they had hidden some electronic equipment or developed some elaborate trick, but I observed that baby with my own eyes. There is no rational explanation. It was then that I faced the most challenging reality of my medical career. Hassan did not represent a clinical case that I would be able to solve through traditional science. Curtis Benson represented the most extreme skepticism of the local community. Influential businessman, known for conservative and prejudiced opinions against religious minorities, especially the small Muslim population of Holston Creek. His public admission of having witnessed something inexplicable carried significant weight. As a doctor trained at an elite institution, I faced the biggest ethical and professional dilemma of my career. 3 clear options presented themselves, each with profound consequences. Complete denial, pretend the events never occurred, omit facts from official medical records, keep my scientific reputation absolutely intact. It would be the safest strategy to preserve my established professional credibility. Forced rationalization, invent a technically impossible medical explanation, distort clinical data, force an inadequate scientific justification to protect my status as a rigorously rational doctor. Acceptance of the inexplicable, publicly admit that I witnessed phenomena that contemporary medicine cannot adequately explain, risking my professional reputation built over 15 years. I spent agonizing weeks consulting more specialized international medical literature, contacting pediatric neurologists from world-renowned universities, exhaustively researching scientific journals, looking for any remotely similar precedent. The result was scientifically devastating. 0 documented cases in world medical history. No record of newborns producing articulated vocalizations. Absolutely nothing that would justify Hassan's case through established medical knowledge. I confidentially consulted Dr. James Patterson, renowned pediatric neurologist at Johns Hopkins Hospital, sending all tests by email without identifying the specific patient. His response was categorically definitive. "Michael, these results indicate absolutely normal neurological development. Any complex articulated vocalization in newborns is neurologically impossible, according to all current scientific knowledge." The choice was becoming inevitable. I should choose between the science I mastered or accept the mystery I witnessed daily. Parallel to my internal scientific struggle, I observed equally inexplicable social phenomena happening in Holston Creek. The city began to change in ways that challenged decades of historical divisions. Christians and Muslims, who maintained rigorous social isolation for generations, began spontaneous interactions for the first time. Deeply rooted prejudices seemed to gradually dissolve. Hassan had become the catalyzing center of social transformations impossible to explain sociologically. Christian families who historically avoided any contact with the Muslim community began greeting the Fosters on the streets. Women wearing hijab received respectful smiles instead of traditional hostile looks. Children from different religious backgrounds played together in public parks. The small local mosque received substantial anonymous donations for necessary structural reforms. The Baptist Church organized pioneering inter-religious dinners. For the first time in the city's history, religious leaders from different denominations met for respectful dialogues. I documented these social changes clinically, as if they were observable symptoms of an unknown behavioral syndrome. My scientific mind searched for patterns, causes, rational explanations for such profound community transformations. Hassan's presence seemed to function as an inexplicable social catalyst. Visitors from neighboring cities came specifically to meet the baby who was born reciting prayers. Some out of curiosity, others out of devotion, many out of scientific skepticism similar to mine. Local journalists tried to interview the Foster family, but Jamal and Hila consistently refused publicity. Hassan is a gift from Allah to our family and our community. He is not a spectacle, Jamal declared respectfully. Hassan remained at the center of all these transformations, growing normally like any child, but maintaining those impossible vocalizations that continued challenging all established medical logic. September 2024. Hassan Foster had completed 5 years when our story took a devastatingly unexpected direction. On a sunny Tuesday morning, Hila Foster urgently sought me at the office, carrying Hassan, who presented sudden and inexplicable high fever. The child, normally active, communicative and playful, was visibly apathetic, with body temperature of 40.2 degrees and worrying neurological signs. I immediately admitted Hassan to the pediatric intensive care unit. As an experienced doctor, I recognized the potential gravity of the clinical picture. I requested complete battery of diagnostic tests, detailed blood count, blood cultures, lumbar puncture for cerebrospinal fluid analysis, cranial computed tomography, brain magnetic resonance imaging. All results returned rigorously within normality. There was no evidence of viral, bacterial, parasitic or fungal infection, no detectable inflammation, complete absence of neurological, metabolic or hematological abnormalities. Medically, Hassan was perfect. But the clinical reality contradicted the laboratory tests. Hassan progressively wasted away each day. He lost weight rapidly. His skin acquired worrying pallor, as if his life force was gradually draining without identifiable medical cause. The entire city mobilized spontaneously. Christians organized continuous prayer vigils at the Methodist Church. Muslims maintained uninterrupted prayers at the local mosque. Jewish families from the neighboring city's synagogue traveled specifically to show interfaith solidarity. For 7 consecutive days, I fought professionally against something that medicine couldn't identify, classify, or treat. I consulted pediatric specialists from across the country through telemedicine. None could explain or resolve Hassan's mysterious condition. It was as if Hassan was being called by something beyond human medical understanding. On the cold dawn of the 8th day of hospitalization, at 3:17 a.m., Hassan Foster opened his eyes for the last time. I was performing my usual night rounds in the pediatric ICU when I noticed subtle change in his vital signs. I approached the bed where Hassan rested, connected to monitors that recorded each heartbeat, each breath. Hassan directed his gaze directly at me, then at his parents who maintained constant vigil beside the bed. His eyes, despite physical frailty, maintained a clarity and depth that impressed me deeply. With surprisingly crystalline and firm voice, Hassan whispered his final words, "La ilaha illa Allah." There is no deity except Allah. The phrase was pronounced with absolute linguistic perfection, loaded with a serenity that transcended his chronological age. There was no fear, pain, or anguish in his expression, only an inexplicable peace that seemed to fill the entire hospital environment. And then, absolute silence. The heart monitor emitted the continuous sound that every doctor learns to fear, the straight line that indicates cessation of cardiac activity. Hassan had departed silently, leaving a legacy impossible to quantify scientifically. In that moment of absolute pain and medical perplexity, I finally understood a truth that my scientific training had resisted accepting. Hassan was never simply my pediatric patient. He represented a living message that I needed to witness, document, and accept, even without being able to understand it completely through traditional scientific parameters. His brief life challenged my concepts about the limits of medicine and human rationality. The ICU nurses wept openly. Even the attending physician, known for his professional objectivity, discreetly made the sign of the cross and murmured a silent prayer. Hassan was only 5 years old, but left an indelible mark on all who witnessed his extraordinary existence. Hassan Foster's funeral represented an unprecedented historical milestone in Holston Creek. For the first time in the city's collective memory, Methodist Christians, Sunni Muslims, Reform Jews, and even declared agnostics united as a grieving family, sincerely mourning the same devastating loss. Reverend Gregory Hill, respected pastor of the local Baptist church, carried the small white coffin along with Imam Musa and Rabbi David Goldstein from the regional synagogue. Curtis Benson, the businessman who initially mocked the Hassan phenomenon, generously donated his central commercial property for construction of a permanent memorial. The Hassan Center was erected 6 months after his passing, an architecturally simple space without specific religious symbols, where people of all denominations regularly meet for individual prayer, personal reflection, and respectful interreligious dialogues. Above the main entrance, a discreet but meaningful plaque, in memory of the child who spoke of peace before pronouncing common words. And me, I continue practicing medicine but completely transformed as a human being. I maintain all of Hassan's detailed medical records in a special file, preserved as documented scientific evidence that there are profound mysteries that contemporary medicine still cannot reach or adequately explain. I didn't become religious in the traditional denominational sense, but I developed a profound and genuine humility before the inexplicable. My ex-wife Sarah returned home 3 months after Hassan's funeral. "You finally recovered your lost humanity," she observed lovingly. "You understood that being an authentic doctor transcends diagnosing and prescribing treatments." Currently, I divide my professional time between the regional hospital and volunteer work at the Hassan Center, where I offer free medical consultations to economically disadvantaged families of all religions and cultural backgrounds. Hassan lived only 5 years, but his legacy permanently transformed a historically divided community into a family united by something infinitely greater than our superficial differences. As a skeptical doctor who always believed exclusively in the measurable, I learned that the greatest miracles are not always in the tests we can explain scientifically, but in the extraordinary lives we cannot completely explain. If this story touched you in any way, leave your like and share. Sometimes medicine encounters the genuinely inexplicable, and this makes us more complete and humble human beings.